Are you a mother, father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Gami because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents. Are you a mother, father, or you are
Hello,
involved?
everyone, and welcome to Ask the Pediatricians Hour. I am Bimi Salaboide. I'm a pediatrician, and I'm going to be the anchor for today's program. For those of you who have been our regular listeners, you're welcome once again. And if you are just watching for the first time, I want to welcome you specially to this program. Ask the Pediatrician is a program where we discuss topical health issues that affect our children. This program is brought to you by Ask the Pediatricians Foundation, and our goal on Ask the Pediatricians Foundation is to ensure that no child should die from preventable causes of death. And we do that by making sure we talk about these important topics, how we can keep our children healthy and how we can, prevent some of these conditions. And if they do happen, what we should do. And so today I'm going to be talking again on another very, very important topic, something very, very common and something really, really preventable, but it's one of the most common accidents and injuries that we see in children. And we're talking about burns today. All right. So I'm sure most of you have heard about burns. That's what we're going to be talking about today. Let me just make a few announcements. If you have any questions, you can actually ask your question on our Ask the Pediatricians Facebook group. We also have Ask the Physician for the adults, but for children, if you have any questions about the health of your children, you can always ask the pediatricians on our Facebook group from Mondays to Saturday, 24 hours daily, and it is a free platform. And we also have a platform where you can ask your questions anonymously on the group, so people don't need to know who is asking the question. So feel free to do that. You can also actually email me as well as Dr. Bemisala at askthepediatricians.com if you want us to talk about any particular topic on this platform. And so whether you're watching me on our Facebook page or group, I want to especially welcome you. And for those of you who are watching on our YouTube channels, I also want to welcome you. For those of you who are watching on Fresh Waves Radio Facebook page, you're especially welcome. And for those who are listening to us on Fresh Waves Radio, welcome to today's broadcast. And if you're listening to me on Ask Dr. Baby podcast, whether you're listening on the live program or you are listening to a recording after the live program on Thursday at 10 a.m., you are especially welcome. Remember that you can actually listen to all the past episodes of this program on all those platforms where you're watching right now, whether on the YouTube or the Facebook page or on the podcast. You can always listen to past topics if you need them for reference. And you can actually read about some of them as well on our website at www.askthepediatricians.com. So thank you so much, everyone, for joining us today. So I'm just going to go ahead and we're going to talk about what we discussing today, which is burns. I'm sure you all know what burns is. This is injury due to heat in children, of course, and it's one of the most common injury in children. Burns and scald. Scald is when the burns is due to hot water or hot liquid. They are the leading causes of injury in young children, especially our toddlers, because toddlers at that age, the toddlers are children between the age of 1 and 3. They are very inquisitive. And yet they are not mature enough to know what is safe, what is not safe. And so they are mobile, they are moving all around the place, running around the place. And if you're not careful, they are going to sustain bones injuries. And bones injury can be dangerous. It can actually lead to death of children, or it can lead to permanent uh, disability, because children can develop contractures and complications that can affect them for a long time. So it's really, really important that we talk about bones and bones injury in children. All right. So there are different kind of bones. When we talk about bones, there are different kind depending on which agent is causing the burns. We have what we call scars. Scars are the ones due to hot liquid, and this is the most common one in children, especially our toddlers. Okay, hot water burns, or hot tea pouring on children, or hot food, hot oil, or even steam. Any injuries, burn injury that is caused by hot liquid or food or steam, we refer to them as scald injury. It's a form of burns. Of course, we're all familiar with that due to flame. When there's a fire, a house is burning or something is burning, and and the children, are caught in the middle of that. Luckily, that is not so common, except when there is maybe house fire or things like that. Another common cause type of burn injury is what we call the contact. So this is when children make contact with very hot objects, or on the other hand, a very cold object like dry ice. I know it sounds contradictory that ice is causing burns, but it actually can cause burns. But I'm sure most of us are familiar with when it is due to hot objects. So like somebody is ironing clothes and they left the iron plugged in, and the children just contact it, and that can cause injury. Or they put their hand on the hot pot or hot kettle, the contact with the hot objects can also cause bones injury in children. Not so common is what we call friction, like treadmill, when something is rubbing against the skin of a child continuously, that can also cause bones injury. Of course, chemical injuries is very common, especially when chemical pour on children. For example, those who use ear relaxers and things like that. Sometimes you know what I'm talking about, that it can burn your scalp, and it can actually happen in children as well. Some of the chemicals, especially those caustic ones, if they come in contact with the skin of children, they can also cause bones injury. And finally, we have electrical burns. Okay, so children putting their hands in the plug, in the sockets, they're just inquisitive, they just want to know. And some of those, if there's naked wire or something is broken, the children can have electric shock, and it can actually be severe enough to cause a bone injury. So these are the 6 categories of burns. We have the scald due to hot liquid or hot water. We have the flame due to the real fire burning. And we have the contact due to contact with hot objects, and we also have the friction, the electrical, and the chemical burns. So they are all sorts of burns injury. But like I said, the most common causes of burns in children is that caused by hot water and hot food. These are the most common one in children. I can't count how many children we see every year due to burns injury. It's so common, and it's across all the age group, from newborn babies even to older children. Of course, the key age is at the toddlers, because those are the ones moving around and all that. And this is time when mothers, we really need to be alert. We really need to be conscious of the fact that we have these very mobile, inquisitive human beings all around us, and they don't know what is hot, what is cold. They don't understand that. They always want to explore everything, and that can lead to them sustaining bones injury. Luckily, most bones injury are preventable because as long as there's no contact with us, liquid, us, objects, or whatever with the child, then there will be no bones and there will be no challenges due to burns or complications from burns. So today I'm really going to focus more on how do we um, prevent burns. That's number one. And also, what do we do as first aid when burns has happened? So we really want to focus on that. Of course, most time burns, especially when they are severe, they are going to be managed in the hospital. So the goal is not to turn us into experts in managing burns, but is to focus on what is our first aid that we can do as parents, and then how do we, more importantly, how do we prevent our children from having burns? Because burns is very, very largely preventable. All right. So children, like I said, they are mostly they most when you want to talk about prevention, you need to know what are the risks, how does it happen, so that we now look at how to plug those loopholes so that it doesn't happen again. So most children are usually scalded, or burns by hot food and hot drinks. So mom is making a cup of tea and then she's on the phone talking, and the toddler has gone there to grab a cup of tea and pour it all over herself. Or mom is cooking in the kitchen and she has a toddler there in the kitchen, and the toddler is reaching and grabbing the handle of the pot or the fry pan or whatever and is pouring the oil on themselves. These are really, really how it happens most of the time. Of course, another option is when mothers want to give a bath and then they've carried the hot water kettle and they put it there and they're looking for another thing, looking for towel, looking for this, and the toddler has gone there. This thing happen in split seconds. So that's why whenever you have a hot water from the beginning to the end, you must always know where it is. You must be always be conscious of it at time, because it takes only 1 second or even less than a second for a burns injury to happen, and the toddler has gone there and poured the hot water on themselves. So this happens all the time on our Facebook group. We get questions about burns almost daily. So it's very important for us. And these burns, when children, because most times the children are pouring they are dragging the pots or the kettle or the cups, from a height. They tend to pour it on their head, on the face, on the chest, on the shoulder. So they tend to sustain those hot water or hot liquid burns on the head, the face, the chest, and the shoulders. So it's always, and they are not very quick to react to that. So the burns, it tends to very severe. So it's so important for parents to be conscious of this. And burns can be serious. In fact, all burns injury are potentially serious. Sometimes I see people posting pictures of burns and they're still asking, like, how do I treat it? And I'm like, no, the whole child's body is almost peeled up and you have to go to the hospital. So all burns are potentially serious, and even small burns, sometimes depending on the area they occur. So for doctors, we do what we call burn surface area. We tend to measure it. So we say burns less than so percentage is mild, those above certain percentage is severe. But even for those ones that we think they are small percentages or less than 10, but depending on the area they occur. So burns to the face, burns to the hands, they are burns to the perineum, the genital areas, they are counted as very severe burns, no matter how small they are, because they can lead to very severe complications, even though it's just small, but because of that area where they occur. For example, if burns happens to the hand, to the fingers, it can lead to contracture, and which means that the fingers become kind of bent out of shape and the child may not be able to use the finger. And remember that we need our hands to do virtually everything, to write, to feed ourselves, to do many things. So burns involving the hands is a very serious burn. We need to be aggressive with the management of it. The same thing face, And the same thing with the extremities and of course the perineum area. So that's why it's so important that we know how to prevent burns. And when it happens, we are very aggressive. We know when to go to the hospital, because eventually children with burns can end up having the need for surgeries, in fact several surgeries, and some of them will need physio. They will have major complications, and it's a very painful thing to have burns. It can also get complicated with infections. Sometimes we need to give blood, so it's a whole lot of things that can go on when a child has burns. So, and for a condition that is preventable, it is really, really painful. And before I move on, another cause of burns, which I really, in many textbooks, they will not talk about, but which is reality, especially for those of us in Africa, is what I call iatrogenic burns. Like people deliberately burn a child. Yes, people deliberately burn children. Okay, so for example, I've talked about conversions, I think it's the last or 2 weeks ago. And some people, when they are trying to get a child or resuscitate a child in quotes, a child who is convulsing, what they do is to go and put the hands and the legs of the child in fire. And they think, oh, when they are burning the hands and leg, the child will wake up. I mean, I make mention of the fact that the scenario where I had when I was in Lutz, and this child just has what we call febrile convulsion, just fever, then malaria. I can't remember which of them, and the child has convulsion, and because of ignorance, instead of taking the child to the hospital, people think they are trying to help, and they put the child's hands in fire and the legs in fire. So we eventually, of course, by the time they came to the hospital, we treated the fever and the convulsion. Those ones are gone, but then we have to now start treating the burns for weeks and months. That child was in the hospital. That child needs to have surgery. That child needs to, I mean, a lots and lots of money have to be spent. Now, that is a completely preventable burns. I mean, that should never have happened, but it was caused by ignorance. So I should call it burns due to ignorance. And of course, there are also some people that believe in culture, whether they believe that the children are witches or wizards, and then they burn the children. This shouldn't stop. All these are dangerous practices. No child should ever be burnt. And there are some mothers, I won't even know whether I should call them mothers or caregivers or whatever, that they have children as their mates. They are doing child labor, which is even again wrong, which should never be done. And some of them because they want to punish children, maybe because they thought the child stole something or the child didn't do what they asked them to do, and then they go and get hot iron and burn the child. These are dangerous practices. These are things that should never be done. So on no account should you inflict hot water or hot objects as a contact on a child. And on no account should a child who is having convulsion or who fainted or anything have their hands or legs burnt. On no account. We should never do that. These are they don't do any good. They cause a lot of harm to the children. Okay, so please, you will never read those one in books because we don't expect people to be doing those. But those are things that we have to do with in Africa. So this is an opportunity to explain to parents, please, no matter what your child has done, don't use anything on them. Don't put their hand in hot water. Don't do that. If they're having convulsion, if you don't know what to do, do nothing and just take them to the hospital, but don't put their hands in fire. Don't do that at all. Okay, so that is talking about what and how children sustain burns. So I'm going to talk about what is the first aid for burns, because no matter how much we talk about prevention of burns and all that, I tell you that burns still happen all the time. It still happens. And so I think it's important for us as parents to know, what do I do if my child has suffered burns? Okay, because again, there's a lot of myths around burns and what people do when a child has sustained burns. We have a lot of myths, and most of them are actually they worsen the situation again. So let's start with what is right. Then I will talk about what we should not do. So let's talk about the first aid for burns. So if a child has sustained hot water burns or flame burns and all that, interestingly, the treatment or the first aid is the same for all of them. Okay, the first aid is the same whether it's hot water burns or contact burns and all that. The most important thing is that you want to cool the burns. You want to cool the area that is burning. And how do you cool it? Just put the child's hands or the area affected under cool running water. Cool running water, like tap water. That is the easiest one. Just open the tap on the area. So that is the most important thing to do, all right? Because when burns is happening, the temperature is high. So even if you remove the hot water that the child has poured on anything, the area is still burning. So you want to cool, you want to bring the temperature, you want to bring down the heat, you want to bring down the temperature. And what you need to do is normal, cool running water. That's all you need to apply, nothing else. Yeah, it's as simple as that. And please don't use ice cold water. No, and don't use warm hot water. No, of course that makes sense. But no ice cold water. Just cool water is what you need to do. Just let the water run over it for 20 minutes. That is the most. And you can do that even up to 3 hours after the burns has happened. So just run cool water over the burns. That's all you need to do. It's as simple as that. If the child is wearing clothes that are also hot, the water has, the hot water or the hot liquid pour on that clothes as well. Remove the clothes gently. Okay, you have to remove it gently so you don't damage the skin. Please do not remove any skin. Do not burst any blister. Just gently remove the clothes gently and don't uh, cause any damage to the skin. All right, that's what you need to do. And sometimes it is so hard to take away the clothes depending on how it's affected. Like if it is flame injury, for example, sometimes you just need to cut it out. Okay, just cut out the clothes. At that point, what is more important is the child. It is not preserving the clothes or whatever. Just get out the clothes so that the hot water or hot liquid or whatever is coming cut out with the clothes does not keep burning the child. So take off the clothes, jewelries, whatever, and just pour cool running water on the burns. I keep repeating it because I know that people do a lot of things, which I'm still going to tell us, which is what you should not be doing. But what you need to do is what I'm trying to emphasize, because I want you to remember that, because sometimes people remember what they should not do more than what they should do. So what we need to do is to pour cool running water on the burns, on the area, just the area affected. You don't have to bath the whole child or pour water all over the child. No, just the area affected. If it's the chest, if it's the face, if it's the shoulder, if it's the hands, just pour cool running water. Normal tap water, just the normal water, not the cold, not the hot, just the normal temperature tap running water is what you need to target at that time. The child should see, if the child's clothes is not wet or anything, let the child still wear their clothes, because you want the child to still be warm, but you want the area that is burnt or burning to be cool. But the rest of the child should be normal temperature or warm as we want it to be. Now, please do not break the blisters. Sometimes when children have hot water burns, there's some of this blister that you see on the surface of the skin. Do not break them. Do not do anything to them. If it's a very minor bones, like just very tiny, bones, and you've done the cool water, that is all you need to do most times. But if this is really big and there's a lot of blister and all that, or there's the wound, the skin itself has opened up, or it has become a wound and all that, you have to take the child to the hospital. So pour running water. Minor wound, minor, very tiny burns, leave it alone. Uh, Big blisters and all that, you have to take the child to the hospital to seek medical assistance. Please, there are things you should not pour Do not pour ogi, pap, raw pap on the wound, on the burns wound. Don't pour it. Don't pour pap. Don't break egg on the wound. Don't do that. Don't apply any cream, any lotion, all those things. Don't apply them. The first thing and the only thing we want you to do is to pour cool running water and go to the hospital. Because when you get to the hospital, the doctors they know how to do the dressing, and depending on how big the wounds is and all or the bones is, they will tell you what next to do. Whether it's something that we just feel like it will go by itself, just apply a clean dressing over it, or whether it's something that will require further management in the bonds unit. We have the bonds experts in the hospitals, they know what to do. So what the first thing you can do at home is to cool the wound, pour the cool running water and take the child to the hospital unless it is very, very tiny wound. Please don't pour all the other things, no liquid, no other liquid, no lotion, no pap, no egg, no honey, nothing. Just the first thing first is to cool the burn zone. So some of you are going to ask, okay, when do we go to the hospital? Which kind of burns do I take to the hospital? Which one do I just stay at home and be looking at? All right. So the first one is if the burns is deep. So usually for us as doctors, we tend to classify burns depending on which layer of the skin, whether it's just what we call the first layer, superficial burns, or whether it's deep, like you begin to see those whites, like you are seeing whites underneath it. It's really deep. And when it's really deep, the child don't feel pain. The child will not even feel any pain because at that point the knife endings itself is gone. So if it's a very deep bones injury, then those ones you have to take the child to the hospital, no matter the size, as long as it's really deep, or what we call third degree burns, that kind of burns, you have to take the child to the hospital. If the wound is bigger than 30 centimeters, so most of our hands, two fingers together, it's about 5 cm. So if the wound is big, bigger than maybe like, you can just get a sharp roll. Let me not use my fingers. If you think it's bigger than 3 centimeters, otherwise it's really looking big, and or there's blisters, something like look like liquid, like a cyst, like with something like liquid inside, you have to take the child to the hospital. Please do not rupture those blisters, just leave it alone. But you have to take the child to the hospital. Again, like I said in the introduction, the area of the burns affected. Any burns to the face, any burns to the hands, any burns to the genitals, that child has to go to the hospital. It doesn't matter how small the burns is. Those areas are sensitive areas, they are crucial areas. So any burns in affecting the face, affecting the hands, and affecting the genitals, you have to take the child to the hospital. You have to get medical assistance. Or burns to the airway, especially if the child is complaining of, they can't breathe, or they have inhaled smoke. Because really this happens a lot with the flame kind of burns, like how this burning or something was burning and the children have taken a lot of the smoke, or you can see like there's burns to the throat area. That child has to be taken to the hospital. So those are the time for you to take the child to the hospital. Or if you are just not sure what to do, sometimes people feel like, doctors are not worried if you disturb us. It's better to come to the hospital and we say, oh, okay, there's nothing to worry about, and we reassure you, than for you not to come to us until things get complicated, like if the wounds now became infected and there's now secondary complications and we now have to start treating, things are going to be worse. So if you are not really sure whether it is a big wound or a small wound or something you should go to the hospital or not, just go to the hospital, okay? Just go to the hospital and we will see it, and then we'll be able to advise you what to do. So before you come to the hospital, you can just cover the wound, cover the bones. If you have like a gauze or something that is not sticky, you can just cover it. If you don't have that, just any plastic, like your nylon, those kind of thing, you can just wrap it around it. The idea is to want to keep that area. We don't want we don't want it to get dry. We don't want it to be losing a lot of water from the burns area. So you can just cover it and take you to the hospital. And at least within 1 hour, the doctor should be able to see you. And of course, we can take it out and they can apply proper dressing. So just cover the wound with something that will not stick to it, or just like a plastic long cling film or something like that. Just apply it and then you go to the hospital and then the doctors can take it up from there. All right, so that's what you need to do. Again, things not to do: do not use ice water to cool the bones. It's only going to make it worse. Okay, I know it sounds like logical. Like if you've gone for the buns, is like you're using very hot water or hot liquid discussing the buns, maybe we should go straight down to the very cold liquid, then like ice. No, unfortunately no. So the goal is not to go to ice level. The goal is just use normal temperature water or cool water, tap water, to just cool the temperature, but don't use ice. It's only going to make things worse. All right, another thing is don't apply any lotions. I think I've said that before. Making it repetition for emphasis, because this is what people do. Oh, go and bring this, go and bring that, go and bring that, go and bring Everslane, go and bring this. Don't just leave it alone. Don't apply any lotion, don't apply any cream, don't apply any food. All right, any food like pap, liquid pap or cold pap or whatever, uncooked pap, don't apply it. Egg, don't break egg. No, don't break any egg. Butter, don't apply it. Toothpaste, no. Potato, no. Everybody in every culture has their own what I call home remedy that they believe they should use for burns, but really these things are wrong, and they actually contaminate the wounds more, and then we start dealing with infected wound, and infection can be horrible to treat, and sometimes antibiotics may not work and all that. So please don't apply nothing to burns injury. Just cool running water is the best. Cool running water is the best. Cool it and bring it to the doctors, to the hospital, and then they will take it from there. Again, don't apply any lotion, any cream, any food item, egg white, butter, toothpaste, potato, cold pap, which is common in Nigeria. Please do not apply that. Just normal water. All of us has normal water. Just take your water, pour it on it. You can keep pouring the cool water. Let it run. If you have a tap, just open it on it and let it keep running for over 20 minutes. And like we said, we talk about when to go to the hospital, then you just take the child to the hospital. So that's all you need to do. It's very simple, really. Most of the treatment of burns will be done by the doctors. It's really for the big burn. If it's a minor one, yes, those are the ones you can just stay at home and you can use like if it's a sunburn, like sometimes if people that live in areas that sometimes they have sunburn injury, those ones, yes, you can apply those your local gel like aloe vera and all that. But most burns, you have to go to the hospital and they have to take it from there. All right. Now let's talk about how to prevent burns. And I think for me, that's the most important thing. That's my emphasis today, because I really, really don't want our children to have burns at all. I really, really don't want them to have burns because, like we said, it's painful. It can lead to contractions, complications. It can lead to death. Seriously, we've lost some children because they have very bad burns, especially if it is very large, extensive, and they come down with sepsis or infection. Sometimes it's a battle to save the children. So we really, really don't want burns at all. We really, really don't want it to happen. So I'm going to spend the rest of the program emphasizing on how to prevent burns and scalds in children, especially, is more important. Okay, and most burns occur at home. Yes, most of the time children get burns is in their house, in their home, so especially in the kitchen. So I'm going to start with. So it's very important for us to start identifying where it happens, how it happens, because that will tell us what we can do to prevent it. So we know toddlers are the high risk people, children between the age of 1 and 5, especially, and of course, the home is the key area where most of these burns will happen. And of course, in the home, there are areas that are the key areas for burns injury to occur. Kitchen, number one. I saw a picture of a mother who is cooking. This I'm sure most of you saw that picture as well. It went viral, and somebody was trying to praise the mom for being a super mom. So this mom was cooking. She was stirring something on the fire. She was carrying another baby. She was trying to breastfeed, like an infant. And then she has 2 or 3 other children in the kitchen. They were doing their homework in the kitchen, and mom was looking at the people doing the homework. She was stirring something on the fire, and she was breastfeeding a baby. And somebody has posted that picture to tell us that this is a super mom. And when I saw it, I screamed. I screamed my head off. I was like, no, this is a recipe for disaster, recipe for bones. This mom is cooking. She has 3 children who are all under the age of 5. With her in the kitchen. She's even older one, and she's stirring something on the hot fire, and she's not even looking at it. She's looking somewhere else. That is a recipe for disaster. Say, get every children, get all the children out of the kitchen now. I was like screaming my head off. So please, it's so important for us to recognize that that is not a super mom. That is a careless mom. There's nothing super about having all your children in the kitchen when you are cooking, and having even infants in your hands. It takes a second for all that burns injury to happen, and all the soup, whatever mom is stirring, it's just going to pour on all the children, and it's dangerous. In fact, don't. We'll talk about that when we get to the kitchen area. Don't have children in the kitchen at all. Just drag them out completely. So we need to recognize that the kitchen is a very dangerous area. Another dangerous area is the bedroom. When I was working in the children emergency room, we used to have a lot of newborns coming down with burns, newborn babies. And because there's a culture that people believe that the mother herself cannot birth her own baby because you're a first-time mom, or maybe there's some people that are the experts in giving baby birth, and these women will come, and then they just pour hot water. And I can't tell you how many times these women have poured hot water on the newborn babies. They don't even feel the water before they put it on the baby. Bam, the baby sustained burns, newborn baby with burns, and they are rushing down to the children emergency room. So I always tell mothers, you can birth a baby by yourself. You don't need no professional birther, or whatever do you call them. You don't need no professional person to come and birth your baby. And please, before you put anything on the baby, put your hand inside. Okay, put your hand inside and feel that water. If you can't feel it, if you can't put your hand in any water comfortably, don't use the water on a baby. That is very important. And sometimes these mothers are forgetting, because they're doing so many things. So you forgot whether you've missed water or not. So you think you most of the time the thoughts I think I've missed the water. They have not missed the water, and the water is boiling hot. And because sometimes they use a lot of hot water anyway for the babies, which is really unnecessary. And bam, newborn babies that's the commonest reason why we have newborn babies with hot water burns. Very common, very common. So please, these are areas: kitchen, bathroom, of course, occasionally fireplaces. In places where the weather is cold, they tend to have fireplaces, or when children go for camping. So those are the key areas for burns to happen. So how do we prevent burns? So I'm going to talk about the kitchen first. In the kitchen, how do we prevent burns? If I have my way, all the toddlers never in the kitchen. No, don't let them stay in the kitchen at all. So it's so important for us to make sure that we don't let our toddlers be in the kitchen. And even for the older children, you have to supervise them. You have to supervise them all the time. You can never have children in the kitchen and your attention is not there. Second, this injury, the bonds is going to happen. Is going to happen. So keep the children out of the kitchen. Like that mom, that picture I showed. I wish I would have brought the picture, and maybe I should have shown the picture on this program. All the children out of the kitchen. Do your homework in the living room. Do it in any other place. Out, never kitchen area. No, don't set up kitchen homework table in the kitchen area. Never. All the children out of the kitchen. When you are cooking, when you are preparing food, children out of the kitchen. If you have the toddlers, put a gate on your kitchen, okay, so that they can't come into the kitchen without you put the key latch over eye up so that they can't get there. So keep your toddlers out of the kitchen. And if you have to attend to the toddlers, switch off the cooking. Just go and do it and come back. It's better that way so that the children don't. And of course, some of us say, "Oh, yeah, my 6-year-old, 7 year olds, I need to start teaching them how to cook." Fine, but please be there and be attentive. So you are there, not on the phone, not distracted. You are there, fully there. Please, it's also him. I'm trying to say it in a funny way because I want you to remember, but really, these are very serious issues. So please, children out of the kitchen, if they have to be there, they are supervised constantly. And as much as possible for the toddlers, don't even let them in. Put a gate on your kitchen door because they can go there when you're not even there. So especially once they start crawling around and moving around, 1 second they are everywhere and a lot of injury has happened. And when you are cooking in the kitchen, make sure that when you are serving hot food and all that, you have to keep it out of reach. Okay. We use that word out of reach a lot, but I think mothers always think that it's just something rhetoric that doctors like to say, or pediatricians especially we like to say. We say keep medicine out of reach, keep all this out of. We actually meant it. It's actually like we want you to take it very literally. Okay, like a mom yesterday was saying, "Oh, my 8-month-old put salt in her mouth," and how did the 8-month-old even get a hold of salt in the first instance? Sometimes mothers leave tablets on the table, and I've talked about center poisoning before, and children got hold of it. They think it's sweet. So you have to be conscious once you have children where you keep everything. I know it's a lot to think about, but please, for the safety of our children, you just have to be conscious about it. So when you're serving food, and you have to be conscious that I have a toddler who can grab onto the table and all that. So keep them out of reach. It's best you serve the food only when you're ready to sit on it and eat. Don't serve and go away. Don't leave the hot kettle, boiled water, everything on the table so that the people who want to make the tea will come and make it by themselves and you go away. The children will go there, pull on the table. They will try to get a hold of these things, and then most of them can climb the chairs, and before you know it, they have climbed onto the table. Boom, everything has happened. So please keep those things out of reach. It is really, really important. Keep them out of reach. Your kettle, you're boiling. Some of us will boil our kettle on the floor. It is not safe because toddlers can crawl there and pull it out, yank everything out, and pour hot water on themselves. So it's better you use it in the kitchen again. High places where their hands cannot reach. When you are cooking, make sure you turn the handle of your fry pans and other inside. You have to turn them on the inside so that they don't grab it from the open end. You have to just think. We always have to be thinking safety whenever we're dealing with hot liquid. And I always tell mothers, once you are carrying hot kettle, be conscious of it from the beginning to the end. You have to know where you are going and what you're doing. So I always tell mothers, when you want to make your baby's bath, don't go for the hot water until you're ready. Let it be the last thing, okay? Get the cold water, everything, and cold water first before you pour the hot water. I mean, when you pour the hot water, you are returning it straight back to the kitchen, because some people will pour part of the hot water, a little bit is remaining, they will leave it down so that they want to start bathing baby. Sometimes another toddler is crawling down and grabbing hold of that hot the remaining hot water in the kettle, and that's how the baby sustain hot water burns. This has happened. This is a scenario that happen all the time. This is how it happens. So please, when you boil the water, you go into the other room to make the baby's bath water, pour it, and go back to the kitchen. That is the priority. Hot water, you must always know the beginning and the end. You must always be conscious of it, because if you have toddlers, it's so crucial. Okay, in the bathroom again, have I think I've started that. So those of us that have hot water in our bathroom, make sure that your hot water is regulated not to be more than 50 degrees. It's so important. And before you put water all over yourself, even adults, we can sustain burns injury. Make sure you test it. Make sure you feel it first. It's so important. It's so important that we feel. I can't tell you how many newborn babies have sustained hot water injuries. It's always so painful to us, really, because I'm like, how can you put water on a baby without even putting your own hand in it, you know? So please put your hand in it first. Test it first before you put it on the baby. It's so important, so that babies don't sustain hot water injury. And then start with the cold water and pour the hot water. Don't start with hot water, then okay, you go and pour hot water, then you go away. I'm coming back, go and pour the cold water. Before you come back, the baby, somebody who is curious enough in your household has gone there before you, and they have poured themselves hot water. So please start with cold water, so that you go get your hot water, you pour it, you feel it is okay, then you go back and return the hot water. At least somebody goes there, the water they are going to deal with will be warm. And preferably let the children be in their room and all that when you are doing this process, until you are ready for them. That's when you bring them out. So it's so important. So around the home and outdoors, again, lighters, matches, candles, please keep them out of reach. I know we can't overemphasize this. See children playing with matches all the time. Then, children are very curious. They're like, how does it work? And children can burn down the entire house doing that. So please keep those things locked and away from the from where children can reach. For those, it's better you have smoke alarms, especially if you are cooking and some of us are watching our Z Word or all those programs on the TV, and then we forget. But the smoke alarm at least will let us know that something is burning. Always test it, make sure they are working. Please, when children are camping, for the older children, they should be supervised. They should be kept away from campfires, coals and all that. So, this is common for those where big children go camping. It's so important that they are completely supervised. And even the campfire, sometimes the coal is still very hot, even days after, the fire has gone out, it's still very hot. And children may not know. They will just go grab it, think it's hot. I mean, it's looking interesting, and they can sustain burns from that. So we need to be constant about that. We should keep children away from treadmill. That can cause friction burns as well. All right. So I've been talking to us about burns today, and I've been emphasizing more on first aid for burns and prevention of burns, because that is the most important thing. The most important thing is for the children not to have the burns at all, so that we don't have to treat it. But if it happens, we know the first thing to do. So I'm just going to emphasize some of the key points to remember. At least we don't remember anything else for the last 1 hour that we've been talking, close to an hour now. Please remember this thing. Number one, supervise children in the kitchen. If possible, don't keep them in the kitchen. And keep hot food, hot drinks up to fridge. This is the commonest reason why children sustain burns: hot liquid, hot food in the kitchen, around the dining area. Please supervise children. I always say our children must be supervised constantly, and mothers are like, I have other things to do. Yes, but keep your eye on them. Make sure they are where you can see them at every point in time, especially for the toddlers. Let's always supervise them. And then let's limit the temperature in our bedroom to not be more than 50 degrees. And if burns happen, which is what we don't want to happen, but if it eventually happen, please pour cool running water on the burns. That's what we expect you to do. That's the only thing you should do, and go for medical attention. Don't do every other thing else you used to do before, or people have told you to do all the other things. Please don't do that. cool running water over the area that is burnt for 20 minutes and go to the hospital. So this is what you need to do. So I believe that if we put in some of these practices, we should not be having our children sustaining burns. So I'll just take a few frequently asked questions when it comes to burns and we'll wrap it up for the day. All right, the first question here is, should I put a burn cream, in or from the pharmacy on my child's burn? So a lot of people already have some creams and lotions that is meant to treat burns and all that. So people always say that, should I go and buy GV? Should I go and buy, I forgot the name of the popular one now, Dermasin cream? Hey, should I go and just put Dermasin cream and or gentian violet or not, all that's on the burns? So what we will say is that the most important thing is to cool the bones, is to cool the bone, is to bring down that heat. And so what we want you to do is not to go for those cream or lotion first. We want you to use the cold running water. That's what you need to do. Just put the hand, the area affected, not necessarily the hand, whichever area is affected, pull it under cool running water for at least 20 minutes, and then go and see the doctors. Because when you go to the hospital, the doctors or the nurses, we apply what we tend to use a steroid dressing, because we have to clean out any infection around the area, any contamination and all that, because we don't know what germ or bacteria has found their way in. We have to clean it out with antiseptics, and then they apply a steroid dressing over it, so they know what to do. But if you just go for that first without pulling the wound, we don't know whether there's already infection and all that, so it will not be the best. And this is supposed to ensure that the wound will be healed and it will reduce scarring. Scarring is our major concern, because when there's a scar, that is what may cause contraction, especially if it is burns affecting the hands, the face, and all that. So it's best burns are managed by the burns experts. What you need to do, what they really want from us, is just to cool it and then take the child to the hospital. So we don't recommend using all those lotions, except it's a very tiny wound that you don't really need to go to the hospital for. Then yes, you can use those ones. If it's a mild burns, you can just use those over the counter gel, and that is okay. But any other thing else, is best you go to the hospital. All right, so another question is, should I put the child under the cool water or take them to the hospital? All right, so again, some people are like, oh, this has happened, should I just quickly run to the hospital, or should I just do some of this first thing? Cooling the child is still so important. Even if you rush to the hospital, that's the first thing we're going to do. So it's best to cool the wound, the area that is burn first. That should not take you more than like 20 minutes. So it will help, it will reduce the pain. It will also minimize, because the heat will keep on causing damage. That burns, the hot water, the temperature that has gone high, it will keep on causing more damage unless you bring it down the heat. So that is why it's so important that you cool it. But if it's a very serious burns and all that, of course, you need an ambulance service or emergency services. You can call for that. And while waiting for that, you are still putting the cool running water on the affected area. Okay, another question is, what should I do if it's a chemical burns? Because chemical burns, again, like I said, the treatment is still similar irrespective of the kind of burns. It's still to use a large amount of water, because we still want to get those chemicals out. And the easiest way to actually get the chemical out is to use the cool running water. Number one is cooling the temperature. Number two is irrigating and getting as much of the chemical out of the whichever area, whether it's the face, whether it's the skin, or wherever. Just water, or if you have normal saline, we also can use normal saline. And of course, then you still take the child to the closest emergency room. So that is what you can do. So I think I've I hope today you've learned a lot about bonds. I hope none of our children will sustain bonds. And for that not to happen, we have to be intentional. We have to think about the potential areas where bonds can happen in our house. We have to prove we have to will I say bonds prove our house. In other words, we have to make efforts. Some of us, we have the fire engine, the fire extinguisher and all that. That's for the flames. But more importantly, hot water bonds, we have to make sure we think about how it will not happen. And I think 99% of that is for us to being conscious of it, being aware it can happen, which is what I've been trying to tell us all day, and to be conscious at every point in time. You have a child and you're in a pressure area like the kitchen, or you're in a pressure area like the bathroom, you are very alert and you're thinking to make sure that burns do not happen. And if it does, please just apply cool running water, nothing else, and then take the child to the hospital. Thank you so much for listening. If you have any question, you can email us, or you can send a WhatsApp message to the Fresh Waves Radio WhatsApp number, or you can just post it on our Ask the Pediatricians Facebook group, and we will try as much as possible to answer the question in subsequent episode, or whenever we are doing our live Q&A sessions, we should be able to answer that. So thank you so much, everyone, for listening. And I'll see you again same time next week, when we'll be talking about another important topic as relates to the health of our children. So then, it is bye from me. Bye.
Ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Bami, because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents. Are you a mother, father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Bami, because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents.